Hi, my name is Brian Hoeflinger. I'm a neurosurgeon in Toledo, Ohio. I've been a neurosurgeon here for 25 years. This is my son, Kevin, here. We just recently climbed Mount Kilimanjaro together. And we're both very healthy, try to be. We've each done an Ironman, multiple marathons, half Ironman. But one thing I've noticed is through all of that, I've never been able to lose a lot of weight, and I've never tried that hard. But lately, before we climb Mount Kilimanjaro, I've just been gaining weight over the past year, it seems like. And I was up to almost 170 pounds, which is insane for me because I like to live around 160. But it was just so hard. I tried to limit my eating. It seemed like I was still exercising a little bit, but yet I was still gaining weight. So when we went to Mount Kilimanjaro, we were up there for 8 days on the mountain. And you lose your appetite when you're at high altitude, and the food really didn't really.
We were hiking like 7 miles a day at times.
So I literally lost 9 pounds. I'm back down to 161, and I feel so much better. And I just don't want to lose that because it's so hard to lose weight. So Kevin and I kind of thought we ought to go on this healthcare journey to try to get fit, because I really need to start doing strength training.
Well, I think another thing is, so he turned 60 2 days after we summited Mount Kilimanjaro, so you're getting a little older, and muscle mass is a lot harder. I think when you're going that, but it's much more than that. I think it's about longevity, feeling good, looking good. So it's about diet. It's not just about, you're not trying to lift really heavy, which a lot of people are. And I think for me, I thought it would be a cool thing if we did that together and documented it with his platform and doing it, because there's so many people out there who are just trying to run as fast as possible, or they're lifting a ton, they want to look good. But I think there's a lot of people that are probably interested in what do people do, what do they eat, what workouts do they do, just to maintain a level of fitness and trying to not win any competitions, but just live a long, healthy life.
Yeah, and definitely that's what I want to do. I just need to, it's crazy when you look at statistics about how much muscle mass you lose every year after the age of 40. And I'm 60 now, and I feel like I'm so far behind the 8 ball. And so I really need to start just maintaining my muscle, not even grow muscle. I just want to maintain what muscle I have, because it's so important for you as you get older, for your balance and your coordination and things like that. So I just want to try to eat healthier. I'm not trying to be a fanatic. I just want to eat healthy. I'll have, a little bit of treats here and there, but I want to try to, work out a little bit every day, whether it's strength training or walking, but nothing. I'm not trying to beat anybody. There's no competition here. I just want to get healthy for the rest of my life. So that's what we're trying to do, I think, right?
Yeah, I think for me, I have slightly different goals, but it's eating healthy. That's the same for all of us. I want to eat healthy, so our diets will be a little different, but I want to eat as much as possible, just kind of eating out less. I think we all get guilty of the convenience of eating out, but just eating less and less processed foods. I've done it at different points in my life. And I think it's just good to kind of have shared goals. And I think we're just putting it out there for accountability of, we're going to try to put something out at least once a week or more of what we're doing. Like the exercise we're doing, we were joining the gym. I was already at a different gym, but we joined our local college. We're going to try to see how much we can film there and maybe voice over stuff. Going to the grocery store, what we're trying to shop for.
Meals. My wife already tries to make healthy meals, and she's really into that. So we'll have some good meals to show you. And even like sleep, I try to get 7 to 8 hours of sleep a night. And for the most part I can, unless I'm on call and I get called in the hospital. But sleep is so important, and then we'll probably touch upon that as well.
I think, all the factors of trying to live a well-rounded and healthy life, and kind of, I think it's a cool thing, just like with us climbing Kilimanjaro, just as a father-son combo, and just showing you it doesn't have to be, consistency is the biggest thing. I'm a huge believer in that. We talk about that when we've talked about doing how we've done an Ironman or climbing Kilimanjaro. Consistency is what you need, and it's not about doing these crazy efforts, working out for 4 hours one day. It's better to work out 4 days a week for several months in a row, and to just eat healthy to avoid, those big mess ups.
Yeah, and I don't think we're going to pretend to be experts here. We're not experts on all of this, but it is something that, we've done a lot of research on, and through the years have done, dabbled in a lot of the stuff we're going to be doing. So I think it'd just be fun for people to maybe follow along, maybe get some ideas from us, see if we can do it. Gives us some accountability that we should try to do it if we're going to be putting it out there.
That is a good key, is that this is not medical advice. Always contact your primary care physician you see as a doctor, so we do have to say that. But this is just totally our opinion, and we just thought, if it can be useful to one person, then it's worthwhile to put it out there and to see how it goes. And please leave comments. Tell us what you guys think. What would you find useful if we shared with you that we can?
But it works both ways. You know, a lot of our social media, so many people say, you know, you're very inspiring, you really motivate me, and it's kind of cool when people say that to us. But vice versa, when we get these comments, I mean, and people commenting, it motivates us, and I think it'll help us with this journey, keeping us accountable, keeping us motivated. If people kind of interact a little bit, give their comments, give their advice, and then hopefully we can inspire and motivate a few people out there to maybe do it with us.
Yeah, and if there's, I think that's a great point, is if there's anything that you think that would be great for us to try or would work out well, then please do. I think we're constantly, life's all about learning and trying to improve, so. But we're hoping you guys will follow along. We're hoping it'll be interactive. We're hoping maybe it'll inspire someone to keep doing stuff, again, just as more kind of ordinary people who don't seem like pro athletes and stuff. Like some, I feel like, fitness influencers too.
I think a lot for somebody my age, in their 50s, 60s, 70s, I think it's all about just maintaining your health, right? Because, you know, once you lose your health, I don't care how much money you have, what your status is in life, you can't get it back. And so all these people with all this money and all this power, and they get cancer or they get bad diabetes or heart disease and they have a heart attack, it doesn't matter. All that stuff doesn't matter anymore. And I think Steve Jobs proved that too. So this is about just being healthy and trying to increase our lifespan so we can, I want to enjoy my life when I'm in my 70s and be able to play with my grandkids and go to Walt Disney World. I don't want to be in a wheelchair or bedridden or on an insulin pump or something along that line that can inhibit how you live your life.
Yeah, so as Benjamin Franklin said, an ounce of prevention is worth a pound of cure. So I think I think that is the whole goal, is you start not when you already have an issue, like, so you're still physically fit and everything, but trying to build up to have some excess to go against as you get older.
Yeah.
So that's, this is video 1 on that. This is the start of the journey. We're looking forward to it. So.